Okay. My name's Heather, like I said. I'll be your medical assistant today.
Yep.
Can you verify your name and date of birth for me?
Jill Hansen, 0100101.
Perfect. So it looks like you're here today for your physical.
21.
Oh yeah. I don't remember how that works, but that's fine. So it looks like you're here today for your annual physical exam.
Yep.
Perfect. So you are 21 now, and
Yes.
so it is recommended. Happy birthday, by the way.
Thanks.
So it is recommended at 21 that you do have a breast exam with your physical exam, and that's just where the doctor feels for any abnormal lumps or bumps. I know we've talked to you about doing like self breast exams,
Yeah.
but this is a good way for the doctor to feel, because sometimes you might not recognize that there's something different there because it's your own body and you're, feel it every day.
Okay.
So it's just a good way to check for any abnormal lumps or, any abnormal lumps or bumps.
Okay.
And then the other exam that the doctor does recommend is a pelvic exam. And what that is the doctor, I know it seems kind of scary and you've never had one done before, correct? So I can explain it. I'll explain it. So what it is we would have you get into a gown, everything off underneath the gown, including your bra, so we could do the breast exam, and your underwear, so we can do the pelvic exam. So what the pelvic exam is the doctor would take a look at the outside of your vaginal area, and they're just looking for anything abnormal, any abnormal lumps, bumps, changes in the skin, things like that. We're not expecting to find anything, but it is a good way to do a screening to see if there is anything abnormal.
Okay.
The other part of that is that we would do a vaginal exam where the doctor would use an instrument called a speculum, and I can grab one out here for you so you can kind of see what this looks like. So this instrument is called a speculum.
Where does that go?
So what the doctor would do is they put a little lubricant on the end of this and then insert this into the vagina.
Oh no.
And I know it seems really scary. It might be a little uncomfortable, but it shouldn't be painful. You might feel a little bit of pressure, might be a little uncomfortable. It is very quick though. It only takes like less than a minute to do.
What does that thing do?
So all this does is the doctor will insert it into your vagina and then they will open it up just a little bit. And what they do is then they can examine the inside of your vagina and the cervix, which is the bottom of your uterus. And all the doctor would do is take a little Q-tip and do a little swab of the cells in there. It's kind of like swabbing the inside of your cheek with a Q-tip, if you've ever heard of or seen that done.
Yeah.
So you might feel a little bit of, it might be a little uncomfortable, but it shouldn't be painful.
Okay.
And all that does is to check the cells inside to see if there's anything abnormal. Again, we don't expect to find anything, but it's a good way to check and make sure. And then it kind of gives us a baseline of what's normal.
What happens if they find something bad?
If they find something, the doctor would notify you. And then the good part is then we could treat it early if there is anything going on. And that's why we recommend doing it. It's just as a good screening.
Do I have to?
You don't have to. You're not required to. You always have a choice in your medical care. But it is highly recommended by the doctor and everything. Do you have any questions about it? I know it might seem a little scary.
It's a lot scary.
Yeah. But I can stay with you during the exam if you want, and we'll make sure we maintain your privacy. We'll give you a gown. I'll also give you a drape to cover up with.
If you could stay, I'd be more comfortable.
Sure, I can do that.
Okay.
Would that be okay?
Yeah.
Okay. Do you have any other questions?
No. Are there any other things he's gonna do?
So with the other parts of the exam, it's just the normal. Look in your ears, look in your eyes, look at your skin, just the normal stuff. Yep.
Okay.
Yeah.
Okay, I'm good.
And I'll kind of explain step by step what he's gonna do as we go too.
Okay.
Okay.
All right.
So what I'm gonna do is I will get you a gown out and the drape. Would you like to change here and then I can help you get up on the bed, or do you want me to help you get up on the bed and then?
We'll get up on the bed and then I'll change.
Okay, so let me get you a gown out. Get a little blue pad out for the bed here. And then I'll grab you a drape out. So the gown opens in the front, kind of like you're putting a coat on.
Okay.
So it opens in the front so the doctor can do the breast exam. And then I'll give you a drape that you can put over your lap.
Okay.
And then you're familiar with a gait belt like that they put around your waist.
Oh yeah, yeah.
So I'll put one of those on you, really just to make sure that you don't fall when we get you up onto the bed, because it is a little bit of a hop up there.
Okay.
So here's your gown, here's your drape. You said you're going to change there and then get up, or get
No,
up
I'll
here?
get up here and
Okay.
then change.
Let me grab my gait belt then. Here. Sneak in here. some other things out for the doctor.
I'm gonna get this, my little
You just set up a pocket if you want.
out of the way.
Don't know.
Just getting some supplies out here, and I'll grab my gate belt so we can help you over onto the bed. So are you excited about getting your new prosthetic?
I am.
That's awesome.
I actually
I'm gonna go right around you here.
hired an artist to like spice it up and put
Oh,
some drawings on
nice.
it. Yeah, yeah.
That's very cool.
I'm super excited.
Okay, and I will just stand by.
I think
little-
this one will be the last one that I get because I'm done growing.
Oh yeah,
Is what
perfect.
the prosthetist or whatever he is.
Yep.
Cool.
Okay, so I'll have you stand up, and then you can use the bed too to hold on to if you need to. There we go. Perfect. And then I'll take this off you. I'll give you a little bit of time to change, and then I'll come back in with the doctor. Okay?
Okay.
Okay. I will be back in. Hand sanitizer on the way out.
Yeah.
All set?
Yep.
Okay. So to start the exam, we'll have you in the sitting position right there, so you're good to go.
Okay.
Sorry, let me. You're okay. So the doctor's gonna look in your ears with the otoscope. The doctor will look in your eyes with the ophthalmoscope. The doctor's gonna check your reflexes with the reflex hammer, and check your hearing with the tuning fork.
Yep.
Okay, so now what we'll have you do is we'll have you lay back, and we're just gonna do like the breast exam. The doctor will look at your breast and examine your abdomen. One side, now the other side. Okay, so what we're gonna have you do now is if you wanna sit up, you can. It might be a little bit easier. I'm gonna put the foot in, and then I'm gonna have you
Falling out.
put your heel right in here, and then scoot your bottom all the way down to the edge of the bed where it kind of feels like you're falling off almost.
All the way down.
Got it? There we go.
All the
Yep.
way down.
Perfect. Yep, you can stay covered there, and I'll move your pillow for you so you're a little more comfortable, and you can go ahead and lay back. Doctor's gonna do that pelvic exam now.
Oh, that's cold.
Okay,
Okay.
and all finished, so you can go ahead and sit up.
That wasn't that bad.
Yeah, just a little uncomfortable. It's not fun, but it's one of those things. It's good to get checked out.
More embarrassing than
Yeah.
anything. Okay. How often
Okay.
do I have to have those?
So it depends on the results. Sometimes the doctor will let you know once we get the results back. It can be anywhere from 1 to 3 to 5 years. It just depends on your history and things like that. The doctor will decide.
Oh. Okay.
So I'm gonna get you a nice soft Kleenex to clean up with, to wipe up with,
Okay.
and then I will let you. Do you want to get dressed here and then go over to
Yeah,
the
I'll
chair?
get dressed here
Okay.
and then.
So I will step out, let you get dressed.
Okay.
We will give you a call with the results, like I said, in like 5 to 7 days.
Okay.
Or it'll be in your patient portal with like a little
Oh, yeah.
message. You use the patient portal. Okay, perfect. Do you have any other questions?
Not right now.
Okay.
But
I'll-
if I have more, can I call?
You can always call.
Okay.
Yep. I'll be right back in, okay? Hand sanitizer as I leave. Hand sanitizer when I come back in. Okay. Let's help you get back over to your chair and get you out of here. It's kind of a gloomy day out there.
It
though.
is. It's. I know it's
Yeah.
terrible. Thanks for staying with me.
Oh,
during that procedure.
absolutely. No problem. As long as it helps you feel more comfortable,
It did.
no problem. I'm going to kind of come up and around you here. There we go. Okay, I'll tuck this in here just so it's out of the way. I don't know, they make these so long that sometimes it's just in the way, huh?
Well, when you have bigger people, I
Yeah.
guess, right?
That works. Be
Okay.
careful stepping down there. There we go. Perfect. And I can undo you now. There we go. I'll come up and over you. Oh, kind of stuck. There we go.
Yep.
Okay. So you are all set if you don't have any other questions, and I can
No, I don't.
get, do you need help getting out of here?
No, this is a straight shot.
Yeah.
Yep. Beautiful.
There we go.
I'm good.
Okay,
Thanks.
you have a wonderful day.
Awesome, thanks.
And then part of your test out is cleaning the room, and so I would go ahead and clean the room. I'm gonna put gloves on. First thing I'm gonna do is get rid of the dirty stuff on this table. Typically, rooms would have a dirty, like, laundry thing, so this would go in your dirty laundry. Because we just put this on over top of clothing, we usually just put it back in the drawer. Obviously, if a person really uses this, you would not do that. You put it in the dirty laundry. I'm just gonna get it out of the way for us. So, you come to the top of the bed, rip the paper back here, roll it in so the dirty stuff goes in. This is going in the biohazard. And then typically your instruments are disposable. Like this would go in a biohazard. Typically these are single-use lubricants, so that would go in the biohazard. This is your swab that would go to the lab, so that would be sent off to the lab. These instruments you can just wipe down and place on the counter. So technically, I'm just gonna set these over here, but really they would be disposed of because we're reusing the same stuff because it's just demonstration. I'm gonna start there. So I'm gonna grab a bunch of wipes. I like to change my gloves in between just because I touched a bunch of gross stuff and I have to grab stuff out of there, like the wipes out of there. So I'm just gonna toss those ones in the biohazard, put some new gloves on. I like to start with the bed because it typically takes the longest to dry. And I usually grab like 3 wipes because you have a big area to clean there. And you can use this same wipe as long as it's wet and there's no like visible blood. You can keep using it. Pillowcases, a lot of pillows will have like a pillowcase cover that's disposable, or it'll be wipeable like this. I set it on that. That's been wiped, so I'm going to set that there for now. I'm going to wipe the handles on this side. Those anyways. More. All out. This was her drape. Put that right in the biohazard. That fell off the bed. I would wipe down my equipment over here. If your chair is wipeable, wipe the chair obviously. Otherwise they might have a spray that you use. Normally you wouldn't have all this equipment on here. If it's just a table, you would wipe the table. I'm gonna kind of ignore that this is here because we're gonna pretend that table's not even here. I'm gonna wipe down the door handles. I like to wipe down like the top of the hand sanitizer and the soap. I'm gonna wipe down these handles. And then I would wipe down, these are gone. Look at this. Your gate belt. I'm gonna set this up here since that's clean now. Wipe down your countertop. My handles to my sink. I already did these handles up here. We're pretending that these are gone. My tray. That. These would go back up here with a new barrier. And the last thing I wipe down, because it's dirty usually.
You forgot something.
I forget.
The Odo and.
Oh, I did forget that. The otoscope, because normally they're on here. So you wipe down the otoscope and the ophthalmoscope too. I did miss that. Thank you for catching that. Okay, any questions? Then you would wash your hands at the end.